Respiratory Syncytial Virus, or RSV, literally floods the ERs during the fall and winter seasons with sick babies. Today we're talking to the ultimate expert, Beachgem 10, who is a pediatric emergency doctor who treats these little babies who get RSV. There's a lot of exciting news in the world of RSV with 2 new vaccines and a treatment for these little babies that is not a vaccine. I'm Meg Conover, physician associate, and let's get into it.
I'm Beachgem 10. I'm a pediatric emergency medicine physician, which means that I am boarded in pediatrics and pediatric emergency medicine. And I am a mom of 4, which I think is credentials of its own.
Absolutely.
And I've been doing peds emergency medicine for about the last 7 years. I've been on TikTok for about the last 3 years.
Awesome. We're glad to have you there on TikTok. All the stuff you put up is super relevant and it is very helpful. Let's dive into it. What is RSV, and can you describe sort of that disease, its process, what you've seen in your experience from it?
RSV for a lot of people it's a cold, it's a virus, respiratory syncytial virus. For young babies, it creates a unique condition called bronchiolitis. It's different than bronchitis. Bronchitis is in the big airways and bronchiolitis is in the little airways out in their lungs. And it creates inflammation and a lot of mucus. And so what we end up seeing clinically is that we end up seeing babies that are working hard to breathe. A lot of times they're wheezing. They have a lot of nasal mucus. If you've seen a baby with RSV, they're pouring snot out of their nose. A lot of them are having difficulty feeding because it's taking all of their energy just to breathe. And a lot of these babies are normal, healthy babies that never had any problems. They weren't preemies or anything like that. They were full-term healthy kids. But babies that do have those medical problems, heart-lung problems, prematurity, are in a higher risk category to need hospitalization. RSV can cause some kind of prolonged issues, prolonged wheezing, prolonged respiratory issues. And so it is a kind of a big deal. For older kids and adults, most of the time, it's going to be a cold, runny nose, coughing. So RSV, again, for little people can be a big problem. For middle people, generally not that big of a deal. And then honestly, for older people, now that we're doing some testing here and there, we're finding out that RSV is a major cause of hospitalization for respiratory problems for the older population, 60 and older.
This conundrum between babies and grandparents. And they would always tell me, I was with my grandkids and they go to daycare and the wife would get it. She'd be admitted for a long time. And then husband comes in a couple of weeks later and it's like the same thing. It most affects children between what ages, the young ones?
I'd say that there's a little bit. The most severe kids are going to be probably under 9 months old. The younger they get it, the more significant the risk is for hospitalization because their airways are smaller. Feeding is more challenging. 3 months, we're going to be more concerned about. Definitely under 6 months, definitely under 9 months. So the older that they get, the better that they're probably going to do if they get RSV. It's not 100%. We definitely admit kids that are 12, 18 months, 3 years old that have RSV. After toddlerhood, generally they don't have the wheezing, the work of breathing. It's more of just a bad cold unless they have asthma.
Okay, so we know RSV is bad. It can cause bad things. It's common. You've seen it plenty. It affects little babies. What is the new treatment that's coming out this year that's really exciting? Can you talk about that?
So we've actually just like in the last couple of weeks, we've had a bunch of different RSV treatments and vaccines that have been approved. 60 and older population has a vaccine available for RSV, which will reduce the risk of them being hospitalized and getting really sick with RSV, which is awesome. The next people that we have covered is going to be the younger people. Kids under about 24 months of age are this monoclonal antibody available to them. It's called Beyfortus. It is a treatment that generally will be used in the first year of age for young, healthy kids. Kids that are at higher risk can go up to 2 years of age, and it helps protect them from needing hospitalization and being admitted and the other more severe complications, as you can imagine what they would be. Reduces the risk by like 75%, which is really tremendous. We see so many RSV cases in the fall and the winter. Like we've got RSV coming out of our ears. And so we really think that this will make a huge difference if kids are able to take this, if we're able to get it distributed and treat these kids, it'll make a huge difference. I think it was 2 days ago. The RSV vaccine for pregnant women was just approved. Awesome. And I have not done a deep dive into that research yet, but that also decreases the risk of babies getting RSV. Moms generally get the shot in their 3rd trimester of pregnancy. and those antibodies are passed through to the baby.
Uh-huh.
And then the baby has that passive immunity protection going forward, and it significantly reduces the hospitalization risk for them without any treatment. Baby doesn't need a shot or anything like that. Mom gets it and passes those antibodies on. It's
Awesome. Wow.
very
That's
similar
awesome.
to DTaP or pertussis.
I love
We
it. Yep.
give a DTaP in the third trimester to protect babies with pertussis against pertussis until they get their 2-month vaccine. So this is another very promising vaccine availability that can reduce these really sick babies.
So exciting. Just having two little ones. I have a 3-year-old and a 2-year-old, and being in the healthcare, this was during COVID. I have 2 COVID babies, and I was not scared of COVID the second time around. I was scared of RSV.
Yep.
One was born in January, one in July, but the RSV season was weird last year.
It was.
And my little guy ended up with RSV at like 4 weeks old, and the toddler had it, brought it home from daycare, had to get his ear tube surgery postponed. We tried to isolate in the house. So like just knowing that there's some treatment. You could be pregnant, you could have a little baby, but there's something that can help you, because these are healthy babies, like you said, and they just go downhill fast. And there's not a lot you can do if you have other kids in daycare or anything like that. It's really difficult to describe to the public what a monoclonal antibody is.
Yes.
As compared to a vaccine. And we have all this vaccine fear conversation going on since the COVID vaccines. So I worry that a lot of people are going to be hesitant for this for the wrong reasons. So can you explain a little bit about those differences?
100% agree about, the hesitancy that's out there. And I think a lot of it is driven by that misinformation. I can see it in my comment section when I talk about any vaccine, no matter what, is a lot of people saying things. So a vaccine is going to be something that stimulates an immune response in our bodies. So we're giving either a piece of the virus or a piece of the capsid of the bacteria. We're giving something to create an immune response in the body. And then we create our own antibodies, B cells, T cells against whatever that is. So when we come in contact with it, our body kind of has the playbook. It knows exactly what to do to protect us, which is a really great way to protect us, like from things like pertussis and measles and mumps. A monoclonal antibody is different, and it is not a vaccine, and our body doesn't have to do anything at all to get the immunity. It just has to exist. Mono means one, and clonal means lots of the same thing. So this is one clone of an antibody that we are giving to people, little people in this case, that helps protect them. And we just give them the antibodies, and then they're in that patient's body. They don't have to make the B cells and T cells. And so when they do come in contact with that virus, the body is able to just bind that virus, and that can't infect the cells, which is so easy. The only thing, kind of like the backslide of that, is that the antibodies don't last forever. Antibodies have a lifespan just like our red cells and our white cells. And so when those antibodies die, that protection is gone. And so monoclonal antibody treatments have a limited effectiveness. They're only effective for a certain period of time. And we previously had something called Synagis, which was also a monoclonal antibody treatment for RSV, only given to high-risk populations. It was very expensive. It was like $3,600 a shot. And it was only for these high-risk populations, and it only lasted 28 days. And so every 28 days, preemies, heart and lung disease, like really sick CF, Down syndrome, they would have to come every 28 days and get their Synagis shot. They would have to venture out into the public, into a doctor's office, and risk be getting sicker. We have one shot. You go once. The shot lasts for 150 or more days to help protect kiddos from RSV. So basically it lasts the entire season. The next season, if they qualified, they would get a second shot. So monoclonal antibody, very different from a vaccine. You're not stimulating any immune response. Biggest side effects that were listed in the study were a little bit of redness and swelling at the injection site, and a little bit of a rash. Those were the side effects that I saw. There weren't any anaphylaxis cases, which is something that we do occasionally see when we give antibodies to people. Luckily, in these studies of Beyfortus, the monoclonal antibody for RSV, we did not see that side effect. So that is a really good sign that this is a pretty safe, well-tolerated treatment.
I'm just imagining some of the patient's mom with a 3-month-old shows up to pediatrician, and pediatrician says, hey, we have this new treatment. Like, can you give any input on what you might say as someone who's experienced these really sick babies to encourage that? I mean, my brother has a 7-month-old, his first baby. And so I've been messaging him about this, like, hey, have you guys looked into this? Not to be pushy or anything, but like,
So I think that this is important to like have conversations about so that we're getting the education out there so that people are hearing it from medical professionals and not from, someone that has a podcast that's never actually touched a patient. So RSV is very easily transmitted, and there's a very high risk of needing to be hospitalized or even being in the ICU for babies, especially under a year of age. We're talking 1 to 3% end up needing admission. So this is a treatment that's going to significantly reduce that. And every medical treatment on the planet has risks and benefits to it. And I think it's important to weigh the risks and the benefits of this, especially if there are kids in the house, other kids in daycare and school, like baby is at high risk for this. If baby is not going to leave the house and no one else at home is going to leave the house, the risk is less, but it's still not zero. So I think it's important, weigh the risks and the benefits, look at the risk to baby to being exposed to other things. Are they going out? Are they meeting grandparents who could also have RSV? So again, this is a very safe, well-tolerated treatment. They're going to continue post-market analysis, which means that they're going to keep monitoring babies. They're going to be taking reports of any side effects that happen. So I think it's definitely something that we're going to keep an eye on. But out of the thousands of babies that have been studied so far, and some of them are normal, healthy, full-term babies, and some of them have heart and lung problems, genetic problems, prematurity, these babies really tolerated this treatment well, and it was effective.
Yeah, that's so reassuring. What about the kids that fall between that? 2 to 5-year-olds that maybe had asthma last year, like my kids. They were using inhalers. They had the daycare syndrome where they got virus on top of virus. And they were both using corticosteroid inhalers and albuterol throughout most of last winter. And I'm thinking to myself, they're not really included in some of these recommendations. What's the thought on that? And I don't know if we know at this point.
Yeah. So the risk of hospitalization with RSV to the older kids, even the ones that have other medical problems, underlying medical problems, is significantly lower. Most of the time, these kiddos have been exposed to RSV yearly in the past, so they have some immunity built up to it naturally, and so they're admitted to the hospital less, not zero, but less. And so I think that there is the potential down the road that there will be an RSV vaccine that everybody can get more of an active immunity. Similar to the 60-year-olds, they'll probably walk that back to different age groups and, immunocompromised groups. But right now, I think that most kids are going to do fine. And I think it's important to focus on good things like, managing underlying medical conditions like asthma, making sure that we're doing good hand washing to try to keep kids kind of as healthy as we can going into this winter season.
So I looked at some of the comments on your videos, and I know people are talking about breast milk. So what about the mom who's had RSV last season and wants to nurse her infant and thinks that that is the same as the monoclonal antibody? What are the differences?
So breastfeeding is awesome, and it is a way to provide passive immunity. So mom is providing those antibodies to baby. Baby drinks the breast milk, and those antibodies are able to be absorbed in the gut. However, unless mom had an RSV infection like last week, they're not going to be providing a significant amount of protection to the baby. And we're still relying on that baby's absorption of those antibodies. So it is unfortunately not the same. I wish it was. Breastfeeding absolutely reduces the risks of some upper respiratory infections and ear infections by a little bit, not by a ton. We definitely see tons of babies that were breastfed and get infections and ear infections and stuff like that. So breastfeeding is helpful. They are providing passive immunity, but it's not going to provide a significant amount of RSV specific immunity. Unfortunately, I wish it did.
I know. We wish it was the magic cure, but well, that pretty much wraps up the RSV questions. Thank you. You are amazing. You have so much information. I appreciate it so much. Is there anything else that we missed or do you want to say or we should mention?
I think we hit it all.
Yeah.